but I love animal rights also, and GNU Health ecosystem is kind of putting all these ideas together, and trying to put social medicine into health informatics. The project itself is from the NGO GNU Solidario, and it basically provides an umbrella not only for GNU Health but other sort of social projects and animal rights projects, as you can see in this slide. And these are some of the countries and areas where we work currently. It started a very small project in the North Carolina, and today we are very happy that we are very much all over the world. So the GNU Health is not just one single application, it's more of an ecosystem. And we will be talking to this especially on the hospital management system, which is based on Tryton. But we do have other applications with other technology. But yes, the main application, the main system itself is the hospital management system, and we are very, very happy and proud to say that it runs on Tryton. So it's official package. That means that Richard Stallman, long time ago, decided that it will make it a GNU package. So all the development environment and the hard drive and computational resources and so on will be given by them, and we are very happy to be part of the GNU operating system. And as you can see from all these components, I have put it I put this frame in red to show the Tryton framework on it. So I can say today that GNU Health is a leader in living hospital and information systems. That's without doubt. That's the reality, and we are happy about it. It has cost us a lot of time and effort, but today we can say that in the free software arena, that is, GNU Health is the best hospital management system. And I think that I'm quite objective in what I'm saying. And why am I saying this? Well, you know, it's throughout years, many institutions, many hospitals, many even countries have chosen GNU Health as their hospital and health information system. As you can see here, a couple of years ago, GNU Health was declared a digital public good, and by this Digital Public Goods Alliance that comprises the United Nations, UNICEF, German Ministry for Economic and Cooperation, and different entities. But not only that, we have work and adoptions by the World Health Organizations, United Nations University, and many different health institutions and governments around the globe, from public health institutions to research organizations in areas such as genomics, from very small clinics in Africa to the largest hospital in Asia, which is AIMS in India. So yeah, it's a large project with a large community, and again, it's backed by Tryton, and that makes me very happy and at the same time grateful to the Tryton community, because otherwise we would be here today. So this is another example on the adoption by the WHO, where we train the World Health Organization officials, and then they do implementations. in different countries. In this case, is in Cameroon, in Africa. Another very important leg of the project is academia. So we have signed different partnerships with different institutions, and the latest one is it's the Hanover Leibniz University, where we will be holding the GNU Health Con in a couple of months. It will be in September. So I wish and I hope to see you in there. So this is a very, very important part of the project. And now, again, why are we so happy of using Tryton? Because it provides all the needs for where you are a laboratory or you are a hospital to run it successfully. So from the demographics to the electronic health record to the management itself, where you have pharmacies, stock management, and also to be able to report, do analytics on the information that you do on a daily basis on your health institutions. So within all these years, we have not found a single context where we said, well, we cannot do this. So far, so good. We've been able to accomplish all the tasks and challenges that were on the project. So this is an example on how we also integrate GNU Health with other libre projects, like in the case of OrThank, it's a DICON server, so all the medical images, we can either store them locally or just call the OrThank server and retrieve it from there. Reporting, you can do any sort of report with Tryton. In this case, we're seeing the representation and the interpretation of this medical imaging, and the same thing or the things that we see on the screen, we can provide it to the patient by doing a report from it. Another very important part can you hear me? Yeah. Yes, we can hear you. Oh, thank you. So well, excellent. So another very important part in health informatics is the ability of being able to interoperate with other systems, whether are GNU Health or non-GNU Health systems. And that's why we have different interfaces and standards that we have adopted. For example, we pioneered in 2014 the HL7 FHIR standard. So what you see on the right-hand side is just a sample on how you can actually query information from GNU Health and generate HL7 FHIR messages from it. But when we talk about WHO, yes, we have ICD-10, ICD-11, ICPM for different sorts of medical diagnostic and procedure systems. Yeah, you can export the information to JSON, XML, or any sort of open standard that the other, whether it's software or hardware. For example, in the case of lab analyzers, you need to retrieve the information from those analyzers if you did a complete blood sample and you want to integrate that directly into GNU Health. Yes, you can do that, and we are actually doing it currently. The other great thing is how versatile it's Tryton in being able to retrieve or to access information from different sort of devices. So you have the web interface that we are actually looking forward to fully support it for upcoming release. And you have the GTK, which for me is the best thing. And then you have the other one. It's my GNU Health. That's an application from the GNU Health ecosystem, but allows us to actually retrieve information generated on Tryton. And on the back you have desktops with GNU Linux or FreeBSD or whatever Libre system that you have. So now not only we are helping health professionals and health institutions, but we are also providing a tool to the individuals to take care or better take care of their own health, right? One unique thing that we have done on the GNU Health ecosystem is being able to gather and aggregate information coming from heterogeneous environments. So whether you are the lab or whether you are the individual or the health professional, the GNU Health Federation allows you to create this sort of distributed health networks where, in the end, you can do things such as having analytics on as you would see in the upcoming slides from the Ministry of Health in case of epidemics and so on. And of course, being able to keep your demographic and medical data up to date. And again, all of this has been able because of Tryton and the Tryton framework. So yes, we are very happy with it. One other thing that doesn't show here is that Tryton, I think that long time ago, very long time ago, I wrote a paper, no, Bagheera. I wrote a paper about the difference between the concept of open source and free software, and I said, well, and at that time it was called OpenERP, and I said, well, this is one thing that shows, Bagheera, stay here. What we really think about open science and don't have any sort of logging or anything that it would create a deadlock situation on implementations where you are. So again, we are an NGO. We want to deliver freedom and equity in healthcare, and we need to have a framework that allows us to do that. And we know that when you scratch a little bit in many of these so-called open source projects, in the end, it's like the big corporate are there and there is nothing free about it. So in the case of Tryton, that is the case. We are very happy with it. We know that it's free, it will remain free, and that's why we adopted in early 2000. And that is a very important point, as important as how good from the technological point of view is. So yeah, I mentioned before one of the research institutions that is actually working on the trisomy 21 for and other cognitive issues or diseases from genetic background. In this case, what I'm showing in this screen are different natural variants from proteins that generate specific diseases, in this case breast cancer, and all of this is on specific packages or modules within GNU Health. So it's not just about taking daily care of your hospital, but also doing research and doing public health depending on the level that you are moving, whether you are a government, whether you are a research institutions, whether you are just a private doctor's office that you want to run GNU Health on top of Tryton, that's perfectly fine. And yeah, so The idea of this talk was to, I was listening to some of colleagues before saying, yeah, we have Tryton for small implementations. I would say that probably, it works very well for very large implementations, distributed environments, and knowing that what you are putting there, the framework you are putting, it's a community-oriented project that really fits very well with a goal, and we're extremely happy with it, and we really hope and wish, and I'm positive it will be the case, that we will be keeping and working together for the next at least decade, and that makes me very happy about it. So thank you again to the Tryton community. Yeah, Nico, Cedric, Sergi, and all the guys that make this possible. So thank you very much.
Hello? There is any question for Luis? Maybe we can just send to them or no? Questions? So no? Very clear?
Thank you so much.